So digital clubbing, or what is known as finger clubbing, is actually what a medical sign. Okay, because normally if somebody put their hands together like this, it should close up. But when somebody put their hands together and you are seeing a deviation, right? So that means the hands angle from 160, it is becoming what? It is becoming more than 180. Do you understand? It actually shows that there's a disease condition. So we look at the concept of the digital clubbing or finger clubbing. We get to see that, okay, if you see finger clubbing in a patient, what are you suspecting? We get to look at the various causes. So these causes is same thing as what you be suspecting if you see a finger clubbing. We get to look at the types, we look at the diagnostic criteria, we look at the differential diagnosis for what? Finger clubbing. So let's get at it quick. We said that digital clubbing is a medical sign and is characterized by what? Enlargement of the distal phalanx. Let's look at it. Can you see that what? The distal phalanx, they are enlarged. Okay, so that's one of the characteristics, enlargement of the distal phalanx. All right, so as the distal phalanx are enlarged, the nails will now curve. All right, so there's a curvature of the nails and there's loss of the normal angle between the nail and the nail bed. Okay, the normal angle being what? 160. Okay, so if the angle is becoming more than 180, that's when you have a finger clubbing. All right, so you tell the patient to put their hand like this. Causes. So these are basically what? Different disease condition that you should be suspecting if you see a finger clubbing. All right. So chronic hypoxia, that's if there's oxygen deficiency and it's chronic, that means it has been there for a very long time. Okay, chronic hypoxia. Then under the pulmonary diseases, you can be suspecting lung cancer, cystic fibrosis, tuberculosis, bronchiectasis. All of these can cause a finger clubbing. Under the cardiovascular system, you can be suspecting things like what? Cyanotic congenital heart disease, endocarditis, right? So I'm actually making this video because of endocarditis, because this was one of the ways of trying to what? Pick up endocarditis. Okay, then going to the GI tract, you can be suspecting disease conditions like what? Inflammatory bowel disease, liver cirrhosis. Okay, then under infectious disease, you can be suspecting like abscess, osteomyelitis. Under malignancies, you can be suspecting malignancies of the lung, gastrointestinal tract, or lymphoma. Right? So, but the aim of this video was for you guys to actually know what is a digital clubbing or finger clubbing. Right? So types, we have the primary digital clubbing, which is idiopathic. You don't actually know the cause. Then secondary digital clubbing is what is associated with something underlying which is causing the problem. Okay, diagnosis criteria, that's when you use what the Scamroch sign, where you basically what the Scamroch window sign. Okay, so if it's open, that's when you say there's a window. Then for the Lovey bond angle, just try to see if what the angle between the nail and the nail bed is less than 160 degrees. Here they are saying it should be more than 180 degrees. Okay, well, you use the angle. Once it's deviating from the normal, that's a problem. Okay, clinical significance, if you see a finger clubbing, it's just indicating that there's an underlying disease condition. All right, so you dig further and try to pick it up. Okay, so that's it for digital clubbing or finger clubbing.